In the last video, we did a thorough description of the path of blood flow. I have a couple more slides in your set of PowerPoints that show you the same information, just with slightly different images and slightly different technology. So let's go ahead and follow the path of blood flow here. I'm going to use green. I'm going to use green this time. All right. So blood goes through the renal artery and then into the interlobar arteries and then into the arcuate artery and then up the cortical radiate artery. From there, the blood is going to go from the afferent arteriole into the glomerulus. The glomerulus is a spherical capillary bed that is critical for forming urine, for the way your urinary system works. Coming out of the glomerulus is going to be our efferent arteriole. The efferent arteriole takes blood to the peritubular capillaries. Again, really important for understanding how the kidney does its job. As a matter of fact, in our lectures on the urinary system, these four parts, the afferent arteriole, glomerulus, efferent arteriole, and peritubular capillaries, they're super important players in understanding the physiology of the kidney. And then blood is going to go out the cortical radiate artery, and then cortical radiate vein, then the arcuate vein, interlobar vein, renal vein, back to the vena cava. Right? Now, this is an image that I found on the internet. I want to make a point that these numbers are not in order. This is not a list of things in order. As a matter of fact, some of these things that are labeled with a number, like the efferent arteriole, this is a blood vessel, so this is a part of the story we just did, but there are other parts like the descending limb of the nephron loop. This is a part of our next tracing, okay? So this is a nice image in that you can see really clearly that blood goes the arcuate artery, cortical radiate artery, afferent arteriole into the glomerulus, efferent arteriole, and then peritubular capillaries. So I like that about it, but please remember that these numbers are not in any order, right? And here's just a third way of looking at the same information. I'm not going to go over it again. This is an image from your kidney board. It's also found on Cerritos-anatomy.com. But it reminds me that now we're going to start talking about the path that urine takes on its way to becoming urine. The fluid actually starts off as just the watery part of your plasma, and then it gets reabsorbed and modified along the way. Most of it ends up staying in your body, not going anywhere at all. Some of it ends up becoming urine. So we're going to start at the beginning of the path of blood flow. So where do things start? Well, where they start is right here at this structure, Bowman's capsule. Bowman's capsule, it was represented in white on the actual concrete models from your lab. Bowman's capsule is a little catch area that is going to capture fluid that is getting filtered out of this capillary bed, the glomerulus. So we know that the afferent arteriole takes blood into the glomerulus, the efferent arteriole brings blood out of the glomerulus, and in between there's this structure, the glomerulus. The glomerulus is a filtration membrane. The blood pressure inside the glomerulus is unusually high, and the reason is seen very nicely on this image, that the diameter of the afferent arteriole is pretty big. The diameter on the efferent arteriole, pretty small. That causes blood pressure to build up in the glomerulus. More blood pressure in the glomerulus, more fluid is going to get pushed out by hydrostatic pressure. And that fluid is going to start on its journey towards either getting reabsorbed back into the body or ending up becoming urine, right? Could be either one. So the first place that the fluid goes in this journey is going to start here at Bowman's capsule. Then it is going to go in this tube, which is called the proximal convoluted tubule. The proximal convoluted tubule got its name because it's convoluted. Convoluted means all curlicue, very difficult to follow, convoluted. And it's proximal because it is first when we are forming urine. It's the first place that fluid goes as it is becoming either absorbed in the body or becoming urine. And then fluid is going to go down, where is it? Okay, down the descending limb of the nephron loop, then up the ascending limb of the nephron loop. That nephron loop, it might not be obvious yet from this image, but it goes down into the renal pyramid, right? And then we have got the distal convoluted tubule. The distal convoluted tubule is called distal because it's later in the journey. Now, we're done with an area called the nephron at this point, and now we're in the collecting duct. Okay? So collecting duct, glomerulus, nephron loop. Let's see what else we've got. So the nephron. The nephron is talking about all these tubules, not the blood vessels, the tubules. Yeah, I know that blood vessels are tubules of their own, but we call arteries and veins and capillaries blood vessels. These, we don't call them blood vessels, we're calling them tubules. There's no blood in them. There's just fluid that either is going to get reabsorbed into the body or get turned into urine. And it is, we're talking now about a structure called the nephron. What's the nephron? It is the glomerulus plus the proximal convoluted tubule plus the nephron loop plus the distal convoluted tubule. All of those things together make up the nephron. And the nephron is super important for our urinary lectures because it's the functional unit of the kidney. So there are two different words for this kind of catch basin that starts off the creation of urine, and that's one is Bowman's capsule, the other term is glomerular capsule. So pick whichever one appeals to you, right? Bowman's capsule or the glomerulus. Fluid is coming out of this area here, the glomerulus, and it just gets caught right here, and it gets sent on the journey first into the proximal convoluted tubule. Then it'll go into the nephron loop. The nephron loop can be called the nephron loop, or it can be called the loop of Henle, all right? So nephron loop or loop of Henle. Please remember that first fluid goes down into the renal pyramid. So descending limb of the loop of Henle, then ascending limb of the loop of Henle, and then the distal convoluted tubule. Right? The proximal convoluted tubule is the first place things go. The distal convoluted tubule is the second. Now, let me remind you of one thing. There are times when I'm just going to be pointing like to this right here. Maybe I'll be pointing to that. And I'll say, name this tube, be specific. And so you need to know that that is the ascending limb of the loop of Henle, because loop of Henle or nephron loop is not going to be enough. How do you know that that is the ascending limb? You got to know the path that fluid is taking, right? So you got to know that fluid came here, went to the proximal convoluted tubule, right? And then it went down the descending, so that makes this the ascending. The ascending limb of the loop of Henle is always the one that's attached to the distal convoluted tubule, and the distal convoluted tubule is always the one that's attached here to the collecting duct. So if you know the path that fluid takes on its way to becoming urine, you will also be able to get these anatomy questions right. So here is the flow. I say the flow of filtrate. The fluid starts off there in Bowman's capsule. It gets called filtrate because it just got filtered out of the glomerulus. So Bowman's capsule, then the proximal convoluted tubule, then the nephron loop, then the distal convoluted tubule, then the collecting duct. Now, all of those things are microscopically small, but the rest of these things, the minor calyx, major calyx, those things are all big. Let's talk about those as well, okay? So we're still looking a little bit small here. We have got Bowman's capsule, glomerular capsule, proximal convoluted tubule, descending limb of the nephron loop, ascending limb of the nephron loop, distal convoluted tubule. How do I know? Because it's attached to the collecting duct. After the collecting duct, things are going to come out of the renal papilla, right? And when they leave the renal papilla, they're going to be captured by a structure called the minor calyx. So now we look at the whole kidney. Remember, this area is the renal hilum. That has actually nothing to do with the path of fluid flow. But let's talk about a minor calyx. So that collecting duct travels right here through the middle of a renal pyramid. And then it's going to come out. Do you see this little region right here? That's a minor calyx. How do I know it's a minor calyx, not a major calyx? It's a minor calyx, like this is a minor calyx, if all of the urine that's there would have come from a single renal pyramid, right? So all the urine that's in here, it all came from this pyramid, right? What's a major calyx? Well, this is a good example of a major calyx. This area right here. These are just collecting areas, right? The major calyx is like the next largest tube that's collecting urine. And I know this is a major calyx because the urine that I find here, it could have come from this pyramid, it could have come from that pyramid, it could have come from that pyramid. So it's a major calyx. And then I get here to the renal pelvis. Fluid that's here in the renal pelvis, it hasn't left the renal hilum yet, hasn't left the kidney yet. It's this big collecting area, and urine that's there could have come from anywhere in that kidney. That's the renal pelvis. And after the renal pelvis, it's going to go down the ureter. From the ureter, it's going to go into the urinary bladder. Remember, urinary bladder, 2 words, urinary bladder. You only get half a point for bladder. Right? And then after the ureter, it's going to be gathered in the urinary bladder. After the urinary bladder, it leaves through the urethra, right? This is a little more detail that might help you. Ooh, here we are starting at the very beginning, right? And here at the very beginning, blood is going through here. The pressure's really high in here. So the pressure's high in here. So water is coming out at us and it's going to be captured by Bowman's capsule, right? Bowman's capsule or the glomerular capsule. And the first place it's going to go is the proximal convoluted tubule. That tubule, that fluid goes as it's going away from the glomerular capsule. First place it goes, proximal convoluted tubule, right? From the proximal convoluted tubule, it's going to go proximal convoluted tubule, descending limb of the nephron loop, ascending limb of the nephron loop, distal convoluted tubule. How do I know that's the distal one? The distal one is the one that attaches to the collecting duct, right? Everything's the opposite way on the other side. After the collecting duct, let's go back a little bit. I want to show you from our lab model here. Great, right? So here we've got, after the collecting duct, here is the renal papilla, right? The pointy end of a renal pyramid. So this right here is a minor calyx. This is a major calyx. Once we get here, it's the renal pelvis, then down the ureter, from the ureter to the urinary bladder, out the urethra to the outside world. I know, there's a lot. Did we cover everything here? Yes, we did. All right, everything's covered. So this was your last video. And good luck with your path of fluid flow. Remember, as you're memorizing the different parts on the different images, do them in the order of the path of blood flow. Do them in the order of the path of urine flow. What I'm saying is, don't just memorize, oh, that's the cortical radiate artery. Memorize everything, renal artery, interlobar artery, memorize all of them, and then you'll have all of them in your head, and you'll also be practicing the path of blood flow, the path that filtrate flows.